Hello friends, my name is Dr. Kamal Patel from Nisarga Hospital, SIRSI. So today I am going to discuss about osteoarthritis of knee, which we see commonly in lot of population. Normally we feel that joint space is reduced because of osteoarthritis, and people say wrongly that joint space has come in the joint line in osteoarthritis, but actually it is not that way. Usually what happens, we have a joint cushion between two bone surfaces, which we call it as cartilage. Over a period of time, when we are walking and doing different strainful activities, usually there will be wear and tear, and because of that, that cartilage is reduced, and because of the reduction of that cartilage thickness, we see less space while doing an X-ray. So we are going to discuss about osteoarthritis regarding that. So friends, in osteoarthritis, we are going to see why we develop osteoarthritis and what it is exactly, what are the precautions we can take to prevent it, so that we don't go for knee replacement or severe discomforts and deformities. So if I have to discuss about osteoarthritis, we can start with the knee joint first, because we are going to see osteoarthritis of the knee. So in knee joint, as we know, there are four bones. The main bone, which is upper side, we call it as femur. Downside, which bears the weight, we call it as a tibia. Then support for the tibia, we have a bone called as fibula. And over these three bones, there is a small round bone, we call it as patella. So these four bone together makes a knee joint. So to prevent a friction between these two bony surfaces of femur bone and tibia bone, there will be a kind of a cushion between the bones. We call it as cartilage. So this cartilage provides us very flix movement when we are moving around or when we are bearing a weight, and it prevents a friction of bony surfaces directly. As we know, knee joint circumference is almost 1/3 of the waist size, but still it bears the whole body weight. So to prevent early degeneration in knee joint, we have a second cushion also, which called as a meniscus. So along with this cartilage and meniscus, to prevent a friction between these two cartilage and meniscus area, we have a lubrication in the joint, which is called as synovial fluid. Even after having all this meniscus, cartilage and synovial fluid, when we are using this joint for our throughout life by doing different activities like sitting cross-leg or maybe squatting, climbing steps, and sometimes we fall, because of these all activities there will be wear and tear in the joint, and because of wear and tear, that joint space starts reducing because cartilage is been wore out from that area. Friends, in osteoarthritis, we see so many patients in our hospital. We see different symptoms when they come and complain. Usually even you too might have felt all those symptoms, like climbing steps is painful or getting down from the steps is painful. Some patients complain when we are sitting cross-leg, usually they get pain in the knee, or squatting or using Indian style toilet is painful. Or some patients say they are not able to fold their leg completely, or they are saying that their leg is not getting extended completely. Or sometimes we see when patients are telling like night time when they sleep, they are not getting proper sleep because of this knee pain. And even some patients complain when they are sit to stand, when they are sitting and getting up, suddenly they feel a kind of giving away feeling in the knee joint because of less strength of muscles which develops due to osteoarthritis. So today I am going to discuss all these symptoms one by one in this video. So in that all symptoms, first we can start with the pain. Usually when osteoarthritis is in very early stage, we see pain in the medial joint line, or you can say the inner part of the knee joint. To happen pain over the medial joint line, there are some reasons. If you see the femur bone, in that femur bone, lower part of the femur bone, inner part what we have in a femur bone is bit wider and little more longer than the outer part. So what happens when we are standing, usually we use more of our inner side of the knee joint. So when we are using more inner side of the knee joint, as you know, when we are walking, standing, we will be putting more pressure on the inner part. So because of that, we start getting wear and tear in inner part first, then the outer side. So that's why so many patients says when they are getting a pain, usually in osteoarthritis, they complain pain only on the inner side and the pain will not be the outer side. So this could be the first symptoms of osteoarthritis. If any one of you are getting kind of these symptoms, you have to be careful for that. You go and consult with a particular doctor so that you can start doing some precautions and some exercises to prevent it going for the worsening thing. So in that, second symptom is a stiffness, joint stiffness, that is what we say. As you know, when we go and sleep, our joint remains in the same position for a very long period of the time. So when we are keeping a joint in the same position for a very long period of time, the previous day whatever we have done a wear and tear to the joint, body starts doing healing for that area. So that leads to some fibrous tissue formations also in the knee joint, and when joint is being kept in a one position and where there is a less fluid which is moving around in the joint, you feel kind of stiffness. So this is one common symptoms we see, early morning stiffness in osteoarthritis patient. But it's not only on the osteoarthritis. We see sometimes this stiffness and joint pain in rheumatoid arthritis or sometimes C-reactive arthritis also. Better to differentiate whether which condition is leading to that morning stiffness. Even some patients complain about joint stiffness when they are sitting for prolonged time. Say like someone is traveling for more than 2-3 hours sitting constantly in one position. So as soon as they start getting up and move around, initially few steps, say like 10-20 steps will be more kind of stiff and they will not be able to extend your knee completely. So this also can be one of the symptom for osteoarthritis. So third symptoms is swelling. Usually when joint is already wear and tear has happened or there is early stage of osteoarthritis, when the cushion is weaker, when we are moving around and when joint is being used beyond its capacity, usually fluid starts accumulating inside. It will be like a edema, and sometimes we see the redness over the joint line also. Even there will be kind of tenderness whenever we are touching over that area. So these all swelling along with redness and temperature raised over that area are also the symptoms for osteoarthritis. Fourth point or fourth symptom you can say is crepitus. So many people might be experiencing that. When we are sitting in constantly one position and getting up, suddenly we feel like click sound in the knee joint. Or some people feel that continuous kind of crushing sound in the knee joint. So these are called as a crepitus. That happens when the cushion between the knee joint is weaker. Bone to bone surfaces will be much near than the what it is in the normal joint. So that allows the two bones to give a friction between each other, and that leads to the crepitus sound, or you can say that like whatever click sound we get in the knee joint. Even after getting that crepitus and that click sounds, even if we have not done proper treatments for that, when it leads to the further degeneration of the joint, we start getting bony surfaces or wherever the bony junctions are there getting extended over from that area, and that called as osteophytes. So it looks like when we see in a X-ray, we see like extra growth of the bone at the edge of the bony surfaces. So that also is an extended feature of or extended symptom of a crepitus. So fifth point in a symptom is muscles weakness and deformity. When joint is already degenerated, when there is a lot of pain, usually we start minimizing our physical activities. So when we are not much active physically, usually our muscle starts getting weaker, mainly in that quadriceps muscles and hamstring muscles, which are the two important muscles to control our knee joint. When we are not utilizing our body enoughly, this muscle starts getting weak. So finally control over the knee joints will be less. So because of that, some patient complains that when they are walking, suddenly they feel as if they are going to fall, or their leg is not supported, or they are feeling like a giving away feeling. So that is also a reason of osteoarthritis. If someone has these symptoms, they have to be very careful when they are sitting to getting up or when they are walking on uneven surfaces. And when, as I told you, because of osteoarthritis, when we are not utilizing joints enoughly, joint goes in particular deformity. We see some patients with the fixed flexion deformity. That is like when a patient is not able to extend their leg completely. Whenever they lie down in the bed also, there will be mild space left out below the knee area. So that is called as a fixed flexion deformity. If muscles are not sufficiently stretched and utilized regularly, osteoarthritis patient can go for this flexion deformity also. Even we see patients developing genu varum deformity. common language we call it as a bow leg, where patient's leg, instead of remaining straight, it starts getting bent from the outer side, and that leads to change in the walking gait also. We call it as a duck gait or waddling gait, where patient, instead of walking straight, their body will be leaning more on the both the sides. That finally leads to degeneration in hip joints also and lower back also. So as we have discussed now symptoms of osteoarthritis, now I am going to tell you about how we can prevent a further degeneration, or how we can control the degeneration what has already happened. So in that, precautions wise, you have mainly three parts. One is the body weight, second is the muscle strength, and third the lifestyle modifications or the physical activities modification. So as you know, if body weight is more, when we are standing, walking around or doing different activities, we will be bearing that extra 5 or 10 kg weight over the knee joints. So because of that, degenerations will be more, because joints are used with extra pressure. I always give an example of utilization of tire when we are using a truck which is empty, and utilization of tire when a truck is filled. So when truck is overfilled and you used, a tire gets degeneration or wear and tear faster. The same way when body is extra weight, when we are moving around, standing, doing different activities, we get degeneration in the knee joint. So weight reductions or controlling weight is very important to prevent the osteoarthritis in all the population. Second point is the exercise. You can do a specific exercise for your quadriceps muscles, hamstring muscles and calf muscles, because this is the main three group of muscles which helps to control our knee joint. So bony structure is just like a bricks in a wall, and muscles are working as a cement. So if you have a more strength in the muscles, you can give a more strength to the wall. The same way joint also will be preventing over pressure because of standing and doing different activities by muscle strength. So if you have a sufficient strength, you can prevent the degeneration of knee joint. So if you are not doing exercise regularly, try to start doing exercises to prevent degeneration. And third point, as I told, it's a lifestyle modifications. When we are doing different activities, we are pressurizing joints in a different manner. Say like some work, when we are doing constantly in standing position, our body weight falls on the knee joint, and because of that degeneration starts happening more, and there will be more degeneration in the joint. So instead of doing that standing activities, if we can modify those activities in sitting down position, that can prevent the pressure over the knee joint, and we can prevent the further degeneration in the knee joint. Same way, some work ladies especially doing on the floor, sitting cross leg or maybe squatting, also can lead to the degeneration more. So if already pain has started in the knee joint, if we can modify those sitting on the floor activities to sitting on the table or chair activities, that can prevent the further degeneration. Same way, utilization of commode or Indian style toilet. When we are sitting in Indian style toilet, we do a forceful knee bending squatting position. So during that time also, we'll be putting extra pressure over the knee joint. If someone has already started with the degeneration in a knee joint, we can start utilizing commode to prevent a pressure over the knee joint area. Same way, climbing steps and coming down. If you have really requirements of climbing steps and coming down regularly, you can use side railings with the hand support, so that some pressure can be avoided on knee joint. Same way, if you are climbing steps some 5-6 times a day, instead of climbing for too many times, you can do 1 or 2 times and try to finish your all the work, so that that further degenerations can be prevented. So mainly these three precautions, if someone is following, they can maintain osteoarthritis in whichever stage they are, or they can prevent osteoarthritis. So friends, here I have told you about the different symptoms and precautions about osteoarthritis. So if someone is having these symptoms regularly, and still after doing these precautions also, if you are not coming out of those symptoms and still pain is getting worsened, instead of taking a painkiller regularly, better to go for a proper doctor and do consultation, because there are a lot of things are there which we have to differentiate between osteoarthritis, rheumatoid arthritis, or some other knee injury also. So after finding out the exact cause for your knee pain, we can do a proper treatment and you can come out of that pain. Thank you.